please forget everything you think you know about chemotherapy.
Once we posted a video of
Like,
how
them go
cruel to
through
do this
this.
on chemotherapy. I would never.
I would say that most of the time when I put chemotherapy on the table, the answer is no. And I was terrified all day, like, oh, please don't do this to me. Like, it is too soon. Like, we cannot have a relapse. What you did, he's like a puppy now. We call it the chemo sumis.
Hello and welcome to another episode of Tea and Tales. I'm your host, Megan Taylor, and with me today is veterinary oncologist Dr. Bea. Welcome.
Thank you. Thank you so much for having me today.
So because we have a veterinary oncologist with us today, we're going to speak about a word that scares a lot of pet owners when they hear this diagnosis of cancer. But it's also so misunderstood. And I think after speaking with you, a lot of people will feel a lot of reassurance, and there's a lot of misbeliefs as well about cancer that people have, and even...
Definitely, yeah.
So the goal today will be to kind of make people feel a bit more comfortable with cancer and to understand it more.
A bit more comfortable with the word. It's a disease, and it's, of course, something that we need to take a treatment for, and it's something that needs to be checked by a vet, but it's not the end of the world, and is probably something that we can treat for a long time.
Yeah, and I feel like there's just... in veterinary medicine, it changes so much. So in 10 years ago or 15 years ago, what a cancer diagnosis meant to what it means now.
Yeah. It's been a lot of movement in the veterinary community. There's a lot of advances. We have a lot of techniques and new drugs that we have been using with very good results. But most importantly, to give a good quality of life for these pets, because it wouldn't make sense any other way.
Yeah. So is cancer one of the most common diagnoses in pets?
Well,
I would say, right?
Yes, it's becoming like this because pets are getting older and older because we're taking such good care of them. So they're eating just the finest food, and they're being checked by the vet every now and then. We're avoiding transmittable diseases by vaccines, so they're getting older. And this also means that getting into the senior age, oncology is a bit more common for them. So I would say that this is something that is increasing, yes, the rate of cancer, but only because the patients are getting older.
See, that's a common kind of misbelief that it's increasing the rates of cancer, but it's more so just...
It's more just so that our patients are getting older and they have more chances of developing these tumors at
maybe
some
also
point.
the screening, 15 years ago, okay, you didn't know your pet had cancer, you just passed
that
away,
also
but now
helps.
we're a lot more with the screening.
And we have a lot of techniques that we can diagnose tumors that honestly for a very long time before they were under diagnosed because we didn't have the techniques to be able to see them and detect them. We knew that there was something wrong with the pet, but we couldn't really figure out what. And now I think we are getting to more diagnostics. And again, this is not a death sentence, but there's tumors that are going to be more likely to happen in older patients. We're getting older and older patients every year, so we're getting more and more tumors every year.
Yeah, we'll get into more about the diagnostics later. But for now, can you let people know, people love to know, even which breeds, is there certain breeds that are more at risk for cancer or different types of cancer?
Definitely. Well, one of the most prone to have this type of diseases is boxers.
Okay.
They love tumors, and tumors love them. So basically, it's one of our most common patients. But I would say, honestly, yes, there's a predisposition for certain types of tumors. Boxers, they just really like them all equally.
Do you know the reasoning behind this, or it's just one of those?
Yes, they have a genetic predisposition for this, and not only boxers, other dogs can. And there's this genetic condition that they carry, and it will be transmittable from family lines, and they would be more prone to have any type of tumoral disease, either one type of cancer or another. It's called gene P53. And this genetic condition is going to make these patients more likely to visit the oncology consultation.
But that's why it's so important when you have a certain dog breed to know what your dog's at risk at. So we have boxers. Any other ones?
Well, for golden retrievers...
I know that everyone gets so upset when they hear about the golden retrievers.
I know. They're going to get upset, but it's true. Golden retrievers are predisposed to lymphoma. And we have quite a few of these in the clinic right now. But yeah, we can also see some whiter patients that they can have this
whiter cell patients.
White, exactly, like white cats. If they get too much sun exposure, they can get this squamous cell carcinoma in the tip of the ears from sun exposure, just like us. Wear sunscreen.
Wow. Yeah, so of course, and in Dubai as well. So if you have a white cat or a white dog in Dubai,
of sun here, so it is most common in whiter animals more than in darker ones. So
Okay, so what's your advice for people if they have a boxer, they have a golden retriever? Is there a point where you start to say like every year we should start checking for something, or how does it work with them?
I would say every year for every patient, honestly.
Every patient, regardless.
Yeah, exactly. Even
okay. So what would this every year kind of involve?
1 year yearly check is fine. We can do like at the time that we do the vaccines. For senior pets, I would also advise that this exam also includes some blood test, maybe some chest x-rays for some. So literally it is also very useful for younger patients because they're not really exempt from cancer, okay? Younger patients can indeed have cancer. So I would say for all animals, but especially for patients over 10 years old, I would include a blood analysis, like a little more thorough, like to try to catch anything with even when there's no symptoms, which is a very important part of this.
Well, that's what I want to get into now. How can owners, outside of doing these kind of yearly checks, are there symptoms? Because a lot of the time there's just no symptoms. So how can owners what are the subtle signs that they can look for, things they can do to do kind of this preventive work?
Yeah, so basically any growth, any lump that we have is something that it needs to be checked by a vet.
Okay, yeah. So everyone loves to know, like, is this lump cancerous? How do they know?
Exactly. So this we can do a very simple cytology. We do them at the clinic. It usually requires no anesthesia or anything. It's minimally invasive. So basically we use the same needle that we use for blood collection, and we're just going to poke the tumor. We're going to get the smallest amount of cells, but that is sometimes enough to give us if it's inflammatory, if it's a tumor. And if it's a tumor, what kind of tumor? Like what test do I need? Do I need to do abdominal ultrasound for this patient, or this patient goes straight to CT? Because of this lump is telling me that I need to do some staging after. And it can be very useful also for the surgeons to be able to address how to remove and remove it safely with only one surgery, trying to avoid multiple surgeries for just one same tumor, okay? So I would say lumps, yes, every time, please come into the clinic and we will check them.
Is there something like, I know in human medicine we have for the lumps, like the kind of four or five C's or something, like check the color, check the, do we have a similar kind of?
No, I would say any lump at any specific point in the dog and any color, yeah, please do FNA of anything, like fine needle aspiration of any lump.
Okay,
anywhere.
That's solid advice.
Yeah.
All right, so lumps, number one. What else can people look for?
So sometimes it can be the most subtle things, because we're talking about lumps, and this is obviously something that is going to be outside the animal, but some tumors are going to be inside, so we're not really going to be able to see them. So how can we tell? So some patients they might be more tired. Some patients might have some diarrhea or vomiting that we have been ignoring for a while, but is getting more and more frequent for them. So that might be also something. Maybe a patient that was really into exercise and is no longer so active anymore. Like it can be really, really subtle, and sometimes it's just a lump that you can obviously see. But like literally any changes, so any check from the vet could lead to, this auscultation is a bit awkward. Let's do X-ray. Boom. We have a tumor here.
And you see, as a vet oncologist, a lot of people come to you directly, like they understood that it was probably cancer, or is it mainly referrals?
We have both. I really, really like the owners that come really worried to the consult because they saw a lump, and this has happened before. Then the lump is just, like a skin tag or nothing to be worried about, and they are really not sleeping for 2 days until they get to the consult. But yeah, I get both. My colleagues for sure do referrals for me for tumors that they had already starting the diagnosis process for, but also owners would come from the worry after seeing maybe a lump, maybe a tick.
It's often a tick.
Yeah, it can often be a tick. It's fine.
It's hard to know what the difference is. So you've done the diagnosis then at this point, like you've done all the tests that are needed to be done, and people have a lot of questions about the treatments and a lot of worries about chemotherapy.
Oh, yeah. Well, chemotherapy is always the tough one. So for a tumor, it's not always and only chemotherapy. Some tumors, they would require some surgery. Some tumors, they would require surgery and then medical management. Okay, we're going to call it medical management. So for medical management, we're going to have what we conventionally know as chemotherapy, IV chemotherapy, and all the drama that we think chemotherapy is, okay? But then we have also targeted therapy now that we can use as like oral treatment for these pets. Honestly, for chemotherapy, I would say it doesn't really have anything to do with what we think from humans. Okay, we
Right.
have
Well, everyone has this belief that
Exactly.
humans chemotherapy.
Is-
Please, let's resolve this.
Okay, so we have chemotherapy. We think we know what chemotherapy is because we're thinking about human medicine. And we're going to get this image from either friends or family or TV. So we have this very dramatic knowledge of what chemotherapy can do, and it is terrible indeed. But this is not what we're aiming for, because it wouldn't make any sense for me to have a pet that is feeling sick just because I want to try to remove a tumor. So we don't do that. We're going to do always softer treatments. We're going to use less doses. But this is also going to help us create a very good quality of life in the meantime. So when I have an owner and I have to explain chemotherapy, I tell them, please forget everything you think you know about chemotherapy. This is not going to be like this. Usually we don't have any hair loss. Usually we have minimal side effects, and honestly will last for a very short period of time. And honestly, if I have these secondary effects, probably I can do something about it so they don't repeat again in the future. I can adjust the dose. I can give a symptomatic treatment. Or maybe I just need to change the treatment at all. So that is my priority. In human medicine, the priority is going to be quantity of life. We're going to
Try and add
make
on
you
10
go
years.
through this,
Yeah.
and you're going to have a very bad time, but we're going to get through this, okay? But for veterinary medicine, I would say that the main goal is quality of life. So yes, I will probably not be able to cure the cancer because I'm going to use smaller doses, but still the patient is going to be having a very good quality of life in the meantime. So I'm going to be able to keep it comfortable for a longer period of time with the treatment for some patients, okay? Other patients, yes, we can cure those tumors, but it is very, very different from humans. And this is often what takes me longer to explain in the consult, because humans, we believe what we saw from experience, TV, whatever. So it really takes for them a bit of a conversation for them to trust me.
There's a
into
lot
trying.
of pushback from people when they don't understand it, I think, initially.
Yeah.
Like, I remember once we posted a video about pet oncology, and even there was this comment underneath the
Like,
video.
why would you
like,
make
how
them go
cruel to
through
do this
this?
on, the chemotherapy. I would never. But it was like,
I would say that most of the time when I put chemotherapy on the table, the answer is no.
yeah.
But we go through it. This takes time for me explaining, and most of the time they kind of trust me, but until they see it
For themselves. yeah.
exactly after the first week, when they see that the animal had a very good week and was fine, they're now convinced that yes, chemotherapy is everything I told them it would be. But it takes time. It takes a long time for them to realize that indeed they're gonna have a good quality of life, and they're so overwhelmed with the diagnosis, so they don't want to put their pet through anything that would harm him, and me neither. My main goal is to keep them comfortable. So
And then the other thing I think a lot of people don't realize is, like, maybe the most stressful part is just how often they have to come into the vet. Let's say once a week or.
it depends. We have different protocols.
Yeah.
So, for example, we have patients that we see every week.
Yeah.
For example, for lymphoma, these protocols would last for like about 20, 25 weeks. And those patients we see every week. So we really create a bond with them. Some other patients, they have every 3 weeks the chemo. Like, it really, every protocol is a bit different. But those are patients that we actually see very, very often. So we create this bond with them. And it's really sad to see them finish the treatment because you don't get to see them again.
Like, I'm so glad you're feeling better, but
I know.
back.
And it's just selfish. But, like at first they're a bit hesitant, they don't like you. But let's not put this, let's not cover this. Like, we give them so many treats that they love to be here. Yeah.
I know, it's one of my favorite things is like seeing the chemotherapy sessions. Like, the animals adore you and they're just sitting with the owner in the room
It's
for 20,
really,
30 minutes.
really
They're getting
chill.
like hugged by the nurses. They're getting fed. And
Honestly, I think it's a very nice experience for them. Yes, they get the IV. They get pricked once. And then we are just chilling in the consult with the owner. We give many treats, probably too many, sorry. So they get chunkier and chunkier. But it's okay.
And then the other really beautiful thing that I love that you've started to do is these kind of graduations.
Oh, yeah. The graduations are the best. I really love them. They really lift up the spirit because we know oncology is indeed a bit dramatic sometimes. But when we finish a protocol and after working so hard for a patient, being able to finally discharge after all these sessions, I think is just amazing. And I think everybody loves them, honestly.
Well, everyone loves them. For reference, we'll put a video of it in this
yeah,
somehow,
I think it's our little traditions, you know, like they get their
little graduation
diploma,
hat.
graduation hat, much more treats than they should, and this clap from the whole team that has been seeing them go through chemotherapy, and they endure beautifully. So it's just like a little celebration. I think the owners love it too.
The owners love it. That's what I love to watch as well. The owners and like how appreciative they are of everything. So you've already mentioned a little bit that the focus on the chemotherapy is the quality of life, not just the length. And so can you explain a little bit more how they're customized for each patient?
Yes. So we have what books say, and then we have our patients. And our patient, they might not really read books, so they don't know what they're supposed to do. So basically, we have patients that will endure a bit less gracefully and they need more time to recover. So even though protocol says every week, we can put chemotherapy every 10 days for them. If they're having many secondary effects, we can give some medication so we can make them milder and even reduce a bit more the dose if this is what is needed. So every patient is a bit different. And even if the chemotherapy that we're giving is not being tolerated great from the patient, we can change to a different medication probably. So yeah, we like to adapt always the protocol to the patient and not the other way around. So the patient is going to be the one that is going to tell us how to proceed with the treatment.
And do you see a lot of people kind of after they finish the treatment, like how do they know that the pet is healthy? We finished the treatment. Obviously, you will know that.
Well, they need to come for follow-ups, of course. So we do some follow-ups after finishing the chemo. They're not so often as once a week, but we get to see our patients again. And basically, depending on what the tumor was, I will give some instructions for the owner. So for example, let's say we have a lymphoma. Those multicentric lymphoma will show with enlarged lymph nodes. And you can feel lumps everywhere. So we had this patient recently, we did graduation for her, and she came back having some lumps. So of course I read that in my schedule, and I was terrified all day. Like, oh, please don't do this to me. Like, it is too soon. Like, we cannot have a relapse. Let's not think, let's not be negative, but I wasn't really cheerful about it.
Yeah.
But then owner, very obedient, he came to the consult. We did some cytology on the lumps, and it turns out it's not a relapse from the lymphoma. It's basically a fat lump because she got too chunky during chemo and she's still losing weight. So yeah, kind of my fault, but she's not relapsed. Yeah, it was a happy day after all, but I was terrified. I was like, oh, please, Karma, don't do this to me. But really, she's fine, and she's only a bit chunkier now. But this is how we know. We bring them in, we check them again. Oh, they're clear. Okay, so I see you in 1 month, 3 months, whatever. But they need some observation for the rest of their lives,
of course.
Probably.
And I'm sure in veterinary oncology, you kind of get such a close bond with these patients because of how frequently you're seeing them.
Yes, I do. I really love them all. I really know all their names. I have all of their pictures in my phone. And probably, even though I don't remember maybe the weight from the last appointment, I do remember everything else.
Yeah, of course, you get so attached to them.
Yeah.
So let's get a little bit more into spotting cancer earlier.
Okay.
You mentioned the main points to look for, the any subtle signs, change of behavior, the lumps. Owners can often feel that something just feels off. Can it happen by accident, the early detection? Like they're getting like a grooming or they're doing the dental. Does that often happen? These accidental findings?
Actually, yes, it happens a lot. Grooming is a good place to spot these lumps. Okay, so we have them a lot of time coming after a grooming appointment where the groomer saw like a lump or like something that was a bit off. We have these incidental findings as well. Like, for example, maybe we're getting a dental, and through the dental blood work, we saw some changes in the blood analysis, and maybe that leads to an ultrasound that finally leads to finding a tumor. I actually like this type of patient very much because it is usually a happy patient that is not having any symptoms. And honestly, when it comes to cancer, the sooner we do the diagnosis, the better the prognosis. So these are patients that give me, at least they don't have any symptoms. So that's good. I have time to figure out how to help them.
I want to get a little bit into Mythbusters because we spoke about a few things already that are kind of commonly misunderstood. So we'll do a quick fire game. Okay. You will answer me if it's true or false, or myth or true or false.
Okay. True or false.
Okay, first one. Pets don't lose all their fur during chemo.
No, they don't. They don't lose the hair. I have never seen that, actually. It is true that when we do the chemotherapy, they tend to grow the hair a little slower. And you can tell because maybe they have some clippings from an ultrasound. And it takes like a very long time for them to fill that spot, but it doesn't really fall. We do have cats, the whiskers, they grow so slow that sometimes they lose them and they don't have really a backup yet. So they can look like they don't have whiskers during chemo. But that's about it. I've never seen a patient completely bald from chemo or like losing hair like significantly from chemo, I would say.
Question, even in the Pomeranians where they have like alopecia and they have these, do you see it like with them or not even?
Not even. This is the very, very slow hair growth that I mentioned. And especially for Pomeranians, they really, really grow hair very slowly when they know we're looking, basically. So yeah, those ones really, really slow. But I have never seen like losing because of the chemo.
Okay. Chemotherapy makes pets miserable.
Ooh, that's a big no. No. We have seen patients like starting chemotherapy and having like a very, very good week. And even the owners really saying, oh, I don't know what you did. He's like a puppy now. We call it the chemo sumis because we have no explanation for this. But basically like they really often have like normal weeks or great weeks. And you can see the owners sending videos, enjoying a walk at the beach or in the park. Like, honestly, I don't think this is true at all.
Good. If a pet has cancer, another pet in the family would be at risk.
No, I don't see how. No. Basically, we mentioned we have predisposed genetics for this. There are some factors that can indeed make the patient more likely to develop this cancer, but it will not be contagious.
Okay. I want to get more into kind of things that could cause cancer later.
We'll do that later.
We'll stick to the quiz for now. Raw diets or alkaline water can help cure cancer.
I would say we don't have enough scientific evidence for this. I would say it does not substitute this medicine. But I'm open if there's any evidence to try and do this on top of what medical treatments. And
well said, on top of. Some people are like, let's only feed like this raw or whatever and not do any treatment.
Exactly. Some people like they really want to have like this more traditional medicine type of approach, and I'm unfortunately I'm not trained to do that. So what I would mostly recommend is my chemotherapy, and on top of that, we can discuss, but always discuss with your vet the supplements that you're gonna have. Because we need to make sure that they're completely compatible with the chemotherapy treatment.
I'm just going to pause the quiz for a second just to ask you this question. Are there supplements that would interfere with the chemotherapy treatment?
Yes.
Okay.
Yes. So this is why it's very important for you to...
What kind of supplements would interfere?
Well, there's some like Chinese and like weird mushrooms that can really do affect, like even if it's not directly with the chemotherapy, they can maybe cause like extra loading for the liver. And if the liver is something that is a bit delicate at the moment because we're treating with the chemo that goes primarily to the liver, this might be not a good choice. So maybe let's not do that supplement particularly. So this is why you need to share all what you're doing on top of the medicine that we are recommending. You need to share with me what supplements are you having so we can make sure that it's safe.
In combination.
Yeah.
Wow. Okay. Older pets cannot benefit from the treatment.
I don't see how that can be true. Like what is an old pet anyway? Because for me, when I studied in school, like they told me like German Shepherds would live 9 years. That is not true. So imagine denying a treatment for a pet because with 10 years is already too old and is supposed to live 16 years. So that is basically 1/3 of his life that we
just cut.
Exactly. Yeah. So for me, I would say
for us maybe it doesn't sound that long, like 2-3 years.
Exactly.
But for them,
it's a very, very nice survival after diagnosis. Yeah. So I would say no, it's not a contraindication being old. And what is old anyway?
Well said. Cancer can be painful.
Well, yes, we are taking this from humans though, because we are not having many feedback from our patients, but we have to assume that cancer is indeed painful and it can be bothering the patient. So yes, we focus a lot on pain management and to keep them comfortable. It can be a lump that is growing and is causing pain in that area. Maybe it's just like this dyspnea, this like feeling that they don't have enough air. We need to try to make them comfortable.
Okay. All right. So we spoke a little bit earlier about prevention and the risk. Are there any kind of, I don't know, things that are causing it around the home, or things that there's enough evidence on that we know like that can cause actually cancer?
Yeah. Oh well. Again, we're thinking about human medicine here. So what we know from humans, we usually can apply to pets. So for example, we know that there's a genetic predisposition, but we also know that there are certain things that are linked to certain types of cancer. For example, smoke.
Yeah.
Okay, so smoking households are more likely to, for pets in smoking household is more likely for them to develop pulmonary
people
carcinoma.
might be thinking like, my pet doesn't smoke.
Yeah, of course, of course they don't, but you do. So
Yeah.
they're like passive smokers.
Yeah.
Just like humans, it is not that every smoking household is going to have a pet with pulmonary carcinoma. It doesn't work like that. And it doesn't mean that if you don't smoke, your pet will not develop pulmonary carcinoma. But yes, if you see the statistics, probably the patients that are having this pulmonary carcinoma, most of them come from smoking households.
Whatever things.
Asbestos, we know this from human as well. So yeah, what else? Maybe some other chemicals like lead. I don't know. Basically, what we know from humans, we can apply to dogs and cats because it's a very similar percentage, and they're sharing the same space. So most of the time, we're going to be able to apply.
And like you said, the sun as well.
Oh yeah, the sun. Yeah, I forgot about the sun. Yeah, the sun is squamous cell carcinoma. We should try to control the exposure to the sun for these more lighter patients, like white hair cats. They're more likely to develop this in these areas where there's no melanin.
I'm assuming it's the same with the humans then as well. For like the blue-eyed pets, do you also see the increased like rates of
that is very, very rare type of cancer. So we don't see that much. There's no enough studies, I think, to really confirm that. But for the skin, yes, we know it's true. Our most common cancer for humans after sun exposure, I think, is melanoma. For them is squamous cell carcinoma. So we should try to protect them from the sun if possible. Keep them indoors at the higher points of the day. And we even have sunscreen available for pets, specifically for pets.
Wow. Do you recommend this then for?
If there's a patient that is very white and is going to be under sun exposure for a prolonged period of time, yes, I do. I have a border collie and he has a very, very white nose. So the bridge of the nose is actually a spot that scares me when we're going to have a very long hike. So I put some cream on his white bridge.
You know what? Actually, I had another client with a little white dog and they went hiking up into the mountains and he came back completely burnt as well. Because the same thing, you think like the whole day out in the sun on top of the mountain.
And these burns, continual burn and this skin aggression can eventually lead into this carcinoma. So we should think about them as well as having problems from the sun as well.
And what about the impact of diet, obesity, and hormone levels?
Well, yes, there are some hormones that can lead into developing cancer, like for example, for females, having all of these heats, it will have a hormone feedback to the mammary gland tissue, and they will be more likely to develop these mammary gland tumors. And also, like some dogs with, sorry.
We'll come back to it.
Yeah. Sorry.
No. That's interesting, actually, what you just spoke about. So then there's another kind of, not controversial, but a question in veterinary medicine, the best time to spay and neuter the pets. Because some of them are saying, like, if you do it before the first heat, you have a much lower risk of breast cancer.
Yeah. So I would say the answer to this question is it depends.
Okay.
Yeah. Veterinary community will never agree on this with as many points of view. For me, I would say for females, yes, do spay. Okay.
Do spay, but what about the timing?
The timing. Yeah. For larger dogs, I would say let's wait, like 1 year.
This is from a cancer perspective,
yeah,
let's
exactly.
Say, because there's so many elements to it.
Exactly.
So from a cancer
perspective, let's wait for 1 year, 1.5 years. For younger and like smaller animals, let's wait after the first heat. So if we do it after the first heat and before the second heat, is the highest chances we're going to have to completely remove the possibility of a mammary gland tumor. And this is especially important in cats, okay? Because cats have very aggressive mammary gland tumors, and they can be 90% avoidable with a spay when they're young. So this I think there's no discussion here. But for dogs, it can be a bit tricky. For males, it can be a bit tricky. So I would say yes, it depends, but mostly spay.
Okay, and I'm just curious now for myself. So for the males, what is your opinion?
So for the males, I would say for me it depends. If it's not, we have no really clear relation between having a dog that is not neutered with developing tumors that are not testicular tumors, of course.
Prostate is,
So prostate is one of those. Castrated animals can have these prostate tumors as well, and it feels like the studies are saying that even higher chances.
Okay.
So that is why it might not be the case. Please don't freak out. Your neuter dog is fine, okay? But yes,
that's what exactly I want to clarify. There's so many other benefits, and like there's only one element of it is the cancer discussion.
So of course, if we do neutering for the pet, we're not going to have testicular tumors.
That's ruled out.
Yeah. So some patients, for example, if they have one of the testicles is left inside the abdomen, for me is a yes, this patient needs to be neutered. There's no question about this because they will develop a tumor from that testicle inside the abdomen. They will. 75% chances they will.
Wow.
Okay. So we need to remove that. So I would say yes, it depends. For me, it also depends on other factors. It's not always cancer. It looks like it is, but it's not. But for females, I would say for me is more clear. For males, I would say it depends. What are you going to breed with the pet? Is the pet having any behavioral issues because of he's not neutered? Well, that makes it
other elements to think about. Yeah.
But I would say that the most evidence that we have is for females, and very clear in the case of cats. We need to spay.
Okay. And what about early screening and lifestyle awareness?
So, like we mentioned before, I think every patient should come at least once a year for a general check. Even your doctor through vaccine check, he can detect these lumps. He can tell you about, ask you about your changes of behavior in the last year that might be leading into some other tests that might lead into early detection. So I would say let's do that for every patient. And this prevention, it is going to be hard to do because we are not really aware of all the things that can cause cancer. And there's some things that we cannot prevent, like genetics. We cannot do anything about it. But I would say let's do these checkups every year. Let's include some other tests for older patients. And that way we can also be detecting early for these patients so we can have higher chances of being able to do something about it.
And I want to get into what you spoke earlier about, like the kind of newer diagnostics that are available, like the newer screenings that they have. Are you able to tell people a little bit about up and coming?
Yeah, so we have all heard about these markers, like now they're doing this blood test for humans and it comes positive for a marker for...
and even the urine test as well, is it?
Exactly. Yeah. There's some things that we can do, like these biomarkers for specific types of tumors. We are developing them. So in the future, they might be able to tell us if this patient is having this specific marker in urine or blood or whatever. We might be having to screen them for a specific type of tumor. Some of this is already happening. It's not as developed as in human medicine, of course, because
it never is.
It never is. We're always a step behind. But we will get there. We will get there eventually. It's just that these biomarkers, they're like so specific. They need a lot of research to study them. So there's not so much money when it comes to veterinary medicine. So they're focusing on human medicine. And if something we can apply from them, then for sure we will have it soon. But this, this is dreaming. This is just the future.
Yeah. And are there any other new kind of tools for treatment?
So we have been talking about conventional chemotherapy, but now we have also targeted chemotherapy. So this targeted chemotherapy, instead of going for all of the cells that are dividing very quickly, it will go for very specific cells with very specific receptors, which means that it will spare the rest of the body. So we have less secondary effects. So that is something really, really interesting that is happening nearly at the same time as in humans, because we actually develop these medicines with human medicines we develop with animal testing. So we are going to be the ones who are going to be testing for pets and also after applying to humans. And there is for mammary gland tumors in women, all of these specific therapies were at first tried in animals, and we are getting some of those as well. So this targeted therapy, I believe it might be the future.
Wow. Okay. Super interesting.
Yeah.
And is there anything you want to kind of, as we wrap it all up, let people know at home, or kind of a take-home message you want to tell people?
Okay. So first of all, I would like to say this. Your
Sounds
pet
like a
got
long answer.
cancer.
First of all.
Your pet got cancer is not your fault. Okay.
Of course.
Yeah, because they feel very guilty.
I guess because of the really subtle signs, like, why didn't I know?
Exactly.
Yeah.
First of all, it's not your fault. Second of all, this is not the end. We can do things about it. We can try to have a good quality of life for as long as possible. We won't let anyone suffer, so we will not put a pet through a very painful and horrible chemotherapy. It will not make any sense. Mm-hmm. My priority is always going to be quality of life. So I'm in the same page that you are. Okay, when it comes to the owner, I always tell them like we want the same thing. We want them to be okay, and this is what we can do. There's many options, more aggressive, little more middle ground, but overall is just if you want to have all of the information, if you want to have all of the chances, just like try to get the right information to decide for yourself, to have all of the information so you can make the best decision for you and your pet. And it might not be the same for everyone. Some people, they will not like to treat us aggressively because they had like a terrible experience. Okay, then we will do something a bit different for them. Every patient is different and they all deserve like a different approach. So we're here for you for that, and it's not your fault, and we'll try to do the best with the situation that we already have.
Yeah. And for people looking to find out more, or to kind of find more information or more resources, where would you recommend people to look?
Well, so I don't want to say this, but yeah, please use internet. There's a lot of information there. Use with caution, but it's also very helpful because you might not believe that the pets after doing chemotherapy, they're having a good quality of life. But if you go and search through internet and search social media, you're gonna see that they're really enjoying. They're like, get information, get experience from other pets, but please
come to your vet.
Exactly. Let me explain the other part that might not be in the internet. But yeah, you can use internet. Maybe some people, they come to the consultant, they have already everything figured out. Like they know exactly what it's like. Oh my God, they already did the research. So yeah, like use it with caution, and just let us advise you on the best way that we can treat your pet.
That was so helpful, Dr. Baird. I'm sure for so many pet owners as well. People always have so many questions about it, and like we said, so much misunderstanding. So hopefully we've cleared up a lot of the misbeliefs and misunderstandings.
Let's hope this like that.
If you have any more questions, anyone, please let us know in the comments. Or if you have suggestions for other topics you'd like us to uncover, please do let us know, and be sure to subscribe. Thank you. Oh, so interesting. I got really distracted. I was like, what about this?
The part with my brain died, can we cut that out?
It was very good, Bea. Very interesting topic.
I like an end.
Princess type.
Yeah.
You can cut that part too.